Thank you very much, Alan, and thanks for the great work you've always done in helping to advocate more science. Especially thank you for your help with the creation of One Mind for Research, which is our effort to begin to bring together all of the research around the brain and stop siloing it based upon diagnoses. Thank you so much, Charles O'Brien, for being a real leader for all of us who care about addiction and alcoholism, and the fact that we can better treat it through a better understanding of the brain and how the brain works, and taking away the stigma that comes with us not understanding how that whole process of addiction works. We're so indebted to people like you, Dr. Volkow, and so many others who make this their career to understand these issues from a neurobiological basis, which is so crucial to us helping to shatter the myths and misunderstandings of these illnesses as quote-unquote behavioral issues. I frankly don't like the word behavioral. It ought to be called addiction. It ought to be called a brain illness and a brain disorder. But thank you for that work. And I thank Keith for his leadership in Tennessee. And we have to develop better processes for treating addiction, as you said, based upon what we know works. And it's tragic that our healthcare system in this day and age still does not treat these diseases in the way that the evidence dictates they should be treated. It's just shocking when you told about NAS and all the complicating factors of NAS. It's striking that we still don't reimburse for the kinds of things that could help prevent NAS. No-FAS is something I've served on the board of no fetal alcohol syndrome. And this is not new in terms of our understanding, and yet we still seem to find ourselves in the same spot that we do every year. This is not getting better, it's getting worse. I am so grateful that Surgeon General Murthy will be releasing his report tomorrow on addiction. I only hope that it has the same impact that Surgeon General Koop's report had on tobacco, that Surgeon General Satcher's report had on mental health. I don't think there could be a better report at a better time than now. It's not as if we need reminding that this is a disease. We've known it since 1950s. But we're still not treating it as a chronic illness. We're not treating it as a disease. So the operational part of what we're doing here today is not talking about the science, even though we're in the science, location. We ought to be talking about political science, and how is it that we can get political science to match the neuroscience. And so the work that I had the good fortune of doing as someone who was suffering from addiction, while I was also the principal author of the law that helped reimburse for addiction, talk about something you couldn't make up, and negotiating the parity law with my late father, who came from a generation that absolutely denied that this was anything but a character flaw as opposed to a chemistry issue. I mean, try having a father-son discussion while negotiating national legislation. It was all very interesting, to say the least. But what we were trying to do is shatter this notion that there are some brain illnesses that are more acceptable than others. In that parity law, originally we wanted biologically based disorders, severe mental illness. Most of the Congress, in as late as 2008, did not want to add addiction, depression, anxiety to the protections under the Mental Health Parity and Addiction Equity Act, because they thought adding addiction would sink the bill. I'll never forget my colleagues telling me, if you add those addicts, the bill will go down. And today, we still have a tough time enforcing that law because of that same perception that there's some brain illnesses that are okay and some brain illnesses that are really more on the side of moral defect. And we got to get rid of that. We have 45,000 people overdosing every year, and it's climbing. We have 42,000 Americans taking their life every year, and it's climbing. Every other area of medicine we're seeing greater and longer life expectancy, except in the area of mental health and addiction. Those illnesses, brain illnesses, are actually reducing the overall life expectancy of us as a people. And what are we doing about it? We're still not paying for what works. Even though if we paid for what works, we could not only save those lives, we could save the billions of dollars that go hand in hand with all of the death and disability that we've heard Keith just describe. So what are we going to do about this? What we need to do is inform the new Congress and the new president about what it is that they can do to help align financial incentives by Centers for Medicare and Medicaid, which is the benchmark for all private insurers, so that we start to push out the reimbursement of the scientific understanding of how to treat these illnesses. And that is what we need all of you in this audience to do, because all of you are here because you care about this issue and you are within the circles of this town where you can influence public policy. And I certainly hope in the conclusion of today's sessions and after the Surgeon General's release of his report on addiction tomorrow, that we can galvanize people to say, President-elect Trump, we know you lost your brother to alcoholism. We know you know this issue intimately and personally like all other Americans. Members of Congress, we know that this is an issue. Whether you come from a red state or a blue state, we need to be on a bipartisan basis attacking this as the public health epidemic that it is. And that we need to take on the corporate interests, which is the corporate practice of medicine that is imposing much higher and more onerous medical management practices by insurance companies on those seeking treatment for addiction than they would if it were cancer, diabetes, or cardiovascular disease. And we need to call it for what it is. So I hope that you have a chance to go on the Kennedy Forum website and look up parityregistry.org. Parity Registry is my effort to get people to break their own silence, file a complaint with their insurer if they are denied access to care for addiction. And if I can, and we can take those cases to the insurance commissioners of each one of the 50 states, if we can take those stories to the attorneys general in each of those 50 states, we can say, Mr. Attorney General, Anthem, United, Humana, Cigna are all here in this case, in this plan, denying access to treatment for addiction in a way they would never deny it for asthma or cardiovascular disease or cancer. And you, Mr. Attorney General, need to protect your residents from discrimination because of their illness. And if we can do that, we can get insurance companies to start paying for what we know works. Because frankly, as if we've never learned the famous saying from Frederick Douglass, power concedes nothing without demand. It never has and it never will. We need to demand the changes that the scientists like Alan and Charles and Nora and so many else have been telling us is out there, but we still refuse to believe is real based upon the reimbursement rates that we advocate from CMS and that we hold our insurance companies accountable for and how they pay for addiction treatment. So thank you very much for letting me have. We have no caps on how much OxyContin you can write. We have no caps on how much Vicodin you can write. But we're putting the most onerous caps at a time when we're ratcheting down on physicians' ability to write for these medications, which is going to lead all their patients with fire brains, just firing with cravings, and they're going to have nothing to replace it other than to go to the street and overdose. This is a prescription for more deaths. And what are we doing? We're slow walking the rollout of evidence-based treatments and medication-assisted treatment. Unbelievable. My insight would be as someone in recovery. So what's worked for me is something I like to tell others. worked for me. And I have found that the age-old wisdom of Bill W., when he had defined this as a physical allergy, a mental obsession, and a spiritual malady, rings true for me, because it's the same way as saying this is a biopsychosocial illness. Same thing. So you need to address the allergy, the physical, neurobiological aspect of it. Then you got to deal with the mental cues that Charles talked about, the obsession, the craving. And you have to have mental health professionals that can do that. And then you got to deal with the spiritual malady, and that's the social connectedness that we often find is lacking in our society, because we're all spending too much time on our iPhones and our iPads and disconnected. When we think we're connected, we're actually not really, in a humanistic sense, really bonding with fellows. So the power of recovery comes from 12-step, I think, can be translated into a broader philosophy about public policy for us as a nation. Addiction is addiction is addiction. Whether you jump out the 10th story with cocaine or meth, or the 8th story with opiates, or the 3rd story with marijuana, you're still going to have an awfully hard fall. So the notion that there's one type of addiction that's better than the other addictions just defies logic. And yet that logic is actually the prevailing view in America right now. And it is putting marijuana on the fast track to social acceptance, which I believe, like prescribed opiates, is going to lead to greater addiction rates, which themselves, once you start the addictive process, is going to lead, if you're someone who has the disease of addiction like me, is going to want to find more and more substances that are going to get me to where my brain used to be with those other substances. So I think it is the quote-unquote, opening of a door that's going to lead to much bigger problems for us down the line. So my view is that this is a medical civil rights act that we passed with the Mental Health Parity and Addiction Equity Act, and that is that we don't want a separate and unequal system of care to treat illnesses of the brain as opposed to any other illness of the body. And so I would put it in the context of a moral issue, because dismissing people because they're illnesses of the brain, and as you hear Charlie talk about this being a genetic as much as any other illness, if not more so, and mental illnesses as well, simply because people, as Charles said, the luck of the draw, had this predisposition, this genetic profile, the environmental factors that put them in a place where there's nothing intentional about waking up every day and trying to feed your addiction, and in the process alienating everyone in your family, all your loved ones, jeopardizing your economic well-being, probably losing your job, living homeless, and getting locked up. These are not things that the average person wakes up every day and says, listen, how can I increase my chances of losing my family, my job, my life, and my freedom? And that's not what the average person does. So for anyone to say that people take drugs like this when they're addicted, that it is voluntary, is just, not only defying common sense, but as Nora Volkow and Charlie O'Brien and others can tell you, it just violates the basic understanding of the brain. So, but what we need to do is, that's not enough. Just like it wasn't enough for us in the civil rights era to say, okay, we know people are people, but we still have always discriminated against people of color, so let's just continue to do so as long as we can, because that's just the status quo until we pass the Civil Rights Act. Now, we had the civil rights, voting rights, fair housing, fair employment. We still have racism in this country, but what's prohibited is overt discrimination. You cannot practice your discriminatory beliefs. And I think that's the way we move forward with this. We're not going to change stigma in a generation. It may take longer. But what we can do is change the practice of overt discrimination. And there's no way that insurance companies can say, oh, this was their choice and it was a moral hazard, Sorry, we have Charles O'Brien here to tell you if you have any questions as to whether this was a moral issue or a medical issue. We have Dr. Volk out here to explain it to you, Mr. Insurance Company. Okay? Plus, it's the federal law. So I don't care if you want to, live off of the stigma so that you can continue to deny these claims and make greater profits. No longer allowed. That's what we need to do, in my view. And it's going to take that same kind of litigating and fighting and social movement activation that's going to push back on this disease being so denied by insurance companies. And I frankly think in the process of that, we can start to end our own personal denial that these are issues that are moral failings as opposed to medical issues.